John McDonald writes for us here on Flow News 24. His article today is about whether Australian citizens in India should be repatriated immediately, and the very big arguments that are coming, particularly given the number of cases. He writes, reports out of India are horrifying. There are now over 400,000 new cases of COVID-19 a day, and serious cases are many more than the hospital system in India can accommodate. The Indian authorities are doing their best to deal with the problem. On Saturday, they opened vaccinations to all adults, launching a huge inoculation effort that was sure to tax the limits of their government, the country's vaccine factories and the patients of its 1.4 billion people. That is 1.4 billion people. Read that and understand how many it is. The world is providing support, but it is not enough. The US is supplying 1 million doses of vaccine, which is a drop in the ocean of what is needed. India is the world's largest supplier of vaccines, but it is running short because of shortages of raw materials and production problems. There is evidence that major developing countries such as the US are hoarding raw materials, writes John. Only a fraction of India's population is able to afford the prices charged by private hospitals for the shot. And local Indian experts have said that their state system will be saddled with immunising 600 million Indian adults, and that is those younger than 45. Their federal government will give shots to 300 million healthcare and frontline workers and people older than 45. In the circumstances, it is in the interest of the global community for the developed countries to get behind a mass vaccination program for India, writes John. This will prevent a global spread of the disease and the prospect of multiple new variants. The global community should also provide pop-up treatment facilities to take the load of the Indian hospital system. On Saturday, 18 patients died when a fire broke out in an Indian COVID ward. Meanwhile, an unseemly debate has broken out in Australia over the return of Australians stranded in India. As Flow News 24 has reported last week, Australian quarantine facilities are at their limit, so the government has paused the return of people from India for a fortnight until quarantine capacity improves. At the moment, 57% of people with COVID who are in our quarantine facilities here have returned from India in the last fortnight. That's over half of those cases. Health authorities do not know how many of these will require hospitalisation. And I think this is where Rex Patrick enters the debate, and this is what he had to say about the issue of bringing Australian citizens home and the legislation that the government could be using to actually put that in place.
Well, my view is that the role of the Australian government is to help Australians in difficulty overseas, not to criminalise them for trying to come home. In some sense, this is a sledgehammer being used to crack a nut. There are a number of different ways in which Australia can control entry into the country, imposing requirements on airlines, for example, that doesn't involve putting someone in a situation where, in desperation, they attempt to get home and find themselves locked up in jail.
So we see that the system that the government is putting in place was the ISIS legislation, where fighters that went from Australia, who were Australian citizens, who were barred from coming back home. The government suggested it could use similar legislation as that to preclude people coming home with a condition like COVID-19 from overseas. And this, of course, has some issues. There are cricketers that have returned to Australia via India's Qatar without fulfilling the necessary quarantine requirements. As a consequence, the government introduced penalties under the biosecurity law that impose fines and possible jail sentences for Australians who return through third countries. Human rights groups are arguing that Australia's restriction on the return of Australians from India is a violation of their human rights. Amnesty International and others have joined the chorus. However, Foreign Minister Marise Payne denied that the restrictions were racist because they did not apply to returnees from other countries. She said they had been applied solely on the basis of medical advice. I think that, to say it's a racist thing, I don't think that's in fact the case at all. It's nothing to do with the nationality of the people. I mean, they're Australian citizens, aren't they? So this is not about that. This is about trying to protect our own system here initially, and then maybe using what we have left over in supplies and so forth to be humanitarian and help India with their crisis. I think that India has moved to be much more advanced in its industrialisation and its medical medical and pharmaceutical facilities, it is their own issue to deal with initially, and the help that everyone can help with in terms of humanitarian help, whatever that might be, well, then that comes after other countries have got the ability to do and provide that help. I think that's where you've got to be very careful not to start throwing around terms like racist and so on. And this, of course, is possibly the greatest health crisis we've had to endure in 100 years. So let's keep it in mind to that and keep the discussion on that. You can see that full podcasted interview of what Rex Patrick has to say about the Australian government's position. That is available at Flow News 24, where you get your podcasts.